Hello, welcome to Native Yoga Center. My name is Todd McLaughlin, and today, how to do safe core strengthening for spondylolisthesis. And I'm going to use this skeletal model to help explain what it is we're going to attempt to do. All right, so this is not the best example of a spondylolisthesis because here we have the lumbar vertebra, and I'm going to focus predominantly on a lumbar spondylolisthesis. I know it's a big word. I have a spondylolisthesis, and I am a yoga practitioner and teacher. I have 30 years experience with yoga, and then I found out I have a spondylolisthesis. So I've had to redesign the way that I move through my yoga practice and teaching. And I want to share a couple of tips and tricks that have really helped me out. I have not had a lumbar fusion surgery. I'm opting to try to avoid that as long as possible. Please consult with your physician. And this is just some advice that I have learned for myself, and I just want to share with you. But ultimately, it's up to you, and you got to speak with your healthcare professional. All right, so, well, the anatomy is important. We have the pelvis, we have the sacrum, which is this triangular bone that meets at the pelvis called the SI joints, sacroiliac joints. And then we have, well, this segment right here is called S1 because it's the sacrum. I'm going to flip them over and you'll be able to see S1. The sacrum is fused and it's the top portion of the sacrum. And then we have the first, well, we have the lumbar vertebra, of which we have 5, going from the bottom, 1, 2, 3, 4, 5. So this is L1, L2, L3, L4, L5. Now you might be dealing, so what is a spondylolisthesis? That is when there's some, the vertebra has actually slipped forward. The vertebra slides, and oftentimes this is the disc space. As you can see, this is like a little padding. Sometimes that is squished, non-existent, ruptured, might not be there. And we can be resting a bone on top of a bone, and it's not even aligned properly. It slides forward. What that creates is what's called stenosis. Now, I'm going to try to angle the skeletal alignment. Does that really show you exactly? I know it's hard to see really close, but basically, we have these processes, these bony landmarks called the spinous process. And the spinal column travels, it's kind of like the protective area around the spinal column, which travels through this little canal. And what happens when a bone, a vertebra, slides forward is it puts pressure on the spinal cord. It's incredibly painful, very painful. And it can feel like just not stable. The idea of doing something radical like jumping off of a chair, or that sounds right. That's not even that radical, but anything that would cause jarring to the body, impact, falling off a bike, anything like that could be really dangerous and risky actually when we're not set stable. So part of the strategy, now the idea is that if you go and you get it checked out, they'll probably say, or they'll do a whole bunch of different things like, let's start with some injections, let's start with physical therapy, and if those don't work, we have lumbar fusion. There's a whole bunch of different surgeries that can be done. But the idea with the fusion is that you would use metal to kind of bolt it all down so that it doesn't have the ability to bend back and forth anymore. So it makes sense. It's a good solution. In some cases, absolutely necessary. So the other element too, though, is that when this gets locked down, the challenge is now the lower vertebra don't move, but the vertebra above it does, and that puts a ton of stress on the joint at the segment above or below where the fusion is. So there's never, I was going to say there's never like a end all be all one fix for everybody that works great. It's very person by person specific, apparently, from everyone that I've spoke with that has had it done. So some people have tremendous results, and some folks say they have challenges after. So our strategy, my personal strategy, is to try to move when I'm in pain, move like I've had a fusion. So that means holding this part of the spine where the spondylolisthesis is, and this rule could apply to anywhere along the spinal column, whether it's in the thoracic or in the cervical, that we would attempt to stabilize that area of the spine through the musculature that's surrounding it. And this is difficult. It's doable, but it requires a lot of attention to detail. And if you're like me and you've been used to exercising intensely your whole life, learning how to pull back is challenging. However, that's what life is all about, challenge. Sometimes for growth, we have to grow. Through growth, through challenge, is what I meant to say. So what I'm going to have you do here is start off with a chair, because I want to imagine you're not working out a lot. You're new to doing movement and yoga, and you have this sort of back pain. You've received potentially a diagnosis for spondylolisthesis. However, you could be dealing with a herniated disc. You could be dealing with a bulging disc. And I find that this philosophy seems suitable from when I've been working with folks. I work with folks every day. That this technique works regardless of if it's a spondylolisthesis or if it's a herniation or a bulging disc. So how to stabilize? Well, number one, we need to become aware of how our spinal column can move and bend. So the basic movements: forward is flexion, backward is extension. We have what is called lateral flexion, where we sideways bend. And then we have rotation, where we make a twist one way or the other. So if I'm going to hold my lumbar unmoving or relatively unmoving, it will always be doing a little bit of movement, but we want to try to isolate the movement to other areas of the body. So if I'm going to move my arms above my head, out to the side, or even rotate, I'm only going to rotate as much as I don't twist into my low back. That's what's really tricky, because if you're used to doing yoga posturing, it's a lot of it's been about just move and try to copy the shape of the teacher or copy the shape of what you see on social media. So you got to just rewire all of this understanding and thinking. So now what we're attempting to do is strengthen the front, strengthen the back, and strengthen the sides. Very basic, super basic, really simple. A standing routine that you can do for the strengthening of the back: lean your hands on the wall, take your leg behind you, bend your knee, and just try to lift one leg behind. Lower that leg down, lift the other leg behind. The classic way to do that on the ground that you're going to get in physical therapy is the bird dog, knees together, one leg back, and practice holding one leg in the air without collapsing your spine into a big bend. We got to work on this sort of a little bit more of the cat pose. Try to direct the vertebra that slid forward back. So if you can hold your core and lift your leg, you would do your one leg at a time. All right. So, and then a side bend is a side plank. And here what we're doing is learning to strengthen the muscles on the side of the spinal column. Now, this one might be difficult to do in the beginning, depending on how much pain you are in and or how much physical activity you're used to. But another way to go about this is to lean against the wall, because this way, vertical alignment, you're now strengthening the side postural muscles, and you would do a right side and, of course, the left side. And I suggest counting or use a timer so that you're holding both sides for the same amount of time. Now, to strengthen the core, to strengthen the abdominal muscles in a way that isn't too aggressive. I want to show you this technique that is very yogic in its origin and nature. So I like to give credit to the old school traditions of India and yoga, where where yoga originates. I didn't make this up. I learned this from my teacher. I just learned it from a different application, but it seems to work really, really well in relation to spondylolisthesis and is a technique called Mula Bandha and Uddiyana Bandha. Oh, there's a lot to talk about, but let me just keep this really brief and short and simple and sweet. Basically, you exhale your air, you hold your breath, and you try to pull your belly in. When you go to let go, you let your belly relax and you breathe in. Let's try it a few times. Exhale, pull your belly in, and then release. So basically, your abdominal muscles, you have your transverse abdominis, which is really deep. You have your internal and external obliques, which are predominantly used during rotation. So really, transverse abdominis and then the rectus abdominis, which is your six-pack muscle, which goes from your xiphoid process down to the pubic symphysis, the center of your chest bone, front center of your pelvis, is going to flex a little bit. So the process of pulling the abdominal muscles in, putting a little bit of forward flexion, and then just pushing the hands down against the knees. And the idea is the thought of trying to lift the rib cage, basically create some lifting energy of the spinal column, so that gravity, which is normally pushing down, and hence we can feel a lot of discomfort to that, we're going to build strength in the process of trying to go up against gravity. So a lot of it is like, if you put your hands on your knees, you can do this from a standing position too. I'm using the down pressure of my hands on my knees to kind of pull the spine up in combination with the abdominal musculature. And I know this is a little bit more to fathom, but the pelvic floor muscles. If I'm going way too fast for you, or it does not make sense, send me a question in the comments from where you're viewing this, and I will happily attempt to answer you. But let me just keep going here. So now the idea is that when you exhale, you're getting rid of all the air. So when you make a vacuum seal, in other words, when you try to pull your belly in, it draws the the abdominal contents, your internal organs. It puts pressure on them, and it will feel like things are lifting up. But you add that with a little lean on your hands and a push. It's like you're trying to resist. It's like you're leaning forward, but then you're pushing yourself back at the same time. So you're using the downward force to create a lifting motion of your lower lumbar vertebra. This is not easy to do. This requires a lot of practice. So a really good way to start to get used to doing this is to lie down on your back and to start off with a very simple exercise of laying on back. And you can do this with legs flat, or if that hurts your back a lot, bend your knees. But the idea is just lift your head, because what you're doing is you're taking the muscles of the rectus abdominis and you're just contracting them. But we're not making any really quick, we're not doing quick, forceful movements where the spine is going to be doing this sort of quick motion bending. It's a holding pattern of coming up and holding really strong squeeze in the belly, and just get all the muscles on the front to contract, and you lower down. So that's a really good way. Include this in your management routine and protocol. Another way that I like to practice this one is to exhale air, push down against the knees, and pull the ribs in and up. So it's like another great way. I'll keep pointing new things out. Hands on floor, squeeze belly, and create a little, like, I'm trying to lift. I'm not trying to get my hips to come off the floor. I'm just trying to create the sensation that the muscles are pulling in and lifting up. I even like to use the visualization that the bone that has slid forward is actually pulling back. And this could be pure conjecture, pure visualization, wishful thinking. I understand. I like to stay attuned with the medical community so that, what's real, what's possible here. So I'm not trying to make some false claim that your bone is going to slide forward or back. No, I mean, maybe a little bit, but why not try? And I'm not forcing, you're not forcing anything. You're not taking something and trying to push it back. You're just training the muscles of the lower abdomen and the belly to engage, to kind of lift and create that gentle traction motion. So, in quick replay, strengthen your back by doing a leg lift and holding your core really strong and stable. Both legs. It can get more complicated with arm movements, or you could put your hand on your belly and kind of push it up while you're lifting your legs. So you're aware if you're moving it or not. You lower down. You do a side plank. You rest on your elbow. You strengthen the side postural muscles. You do a side plank, other side. I'm on my knee. I'm trying to make things relatively easy. You engage your side postural muscles. You utilize some lying on the back to lifting the head to strengthen the front without extreme movement. And then at your discretion, let me do it in the chair. Do I need to hold my breath? Well, that's a good question. Not necessarily. You can keep breathing. Right now, I'm pushing my hands against my knees, leaning the body a little forward, flexing the spine slightly like cat pose, and taking the belly and drawing in and up. So I'm going to try to breathe at the same time that I do that. Yeah, it's possible. And then relax. And you'll feel it. I mean, you're working. And believe it or not, this actually gets you stronger. I know it looks so like, quote, I don't know, should I use this word, wimpy or so basic? We think it has to be so much more grand and difficult, but in actuality, simple, basic, and attentive and focus. Listen to your body, and it really works. So, is every day easy? No. And does it flare up? Yes. Can you manage it? I can. I am currently. Will that change? Possibly. Right now, I'm okay. These are some of the questions that will go through your mind, I'm sure. All right. Does this help? Does it make sense? I'm open to criticism. If you disagree with me, let's have a conversation. I want to learn too. So, thank you. Namaste.